Welcome to Dem Bahamians, a media initiative of the Bahamian American Cultural Society. I'm going to be your host today. My name is Beryl Edgecombe, and my guests are, from left to right, is Soraya Alcott.
Yeah.
Where's Mike? Dr. David Ferris, Nina Anderson,
Hi.
Eric Gans, and Pastor Henry Harrison. Okay, good evening and welcome to Dem Bahamians. And to start the conversation, I'd like for you to give me an overview of where we are as far as AIDS, HIV/AIDS is concerned. Who would like to start? Soraya, would you want to pick it up?
Well, let's
You can introduce yourself for me, please.
Hi, my name is Soraya Alcock, and I am the Senior Director for Policy and New Business Strategies at Harlem United Community AIDS Center. I've been with Harlem United for about 11 years. It's a pretty large and comprehensive community-based health center with an expertise around HIV/AIDS treatment, housing, prevention, and care. So 30 years later, where are we in the HIV/AIDS epidemic? In some ways, it's a really exciting time. I think new scientific advancement, I think new prevention strategies, I think research, I think organizations' ability to provide comprehensive health care for individuals who test HIV positive, our ability to provide support services, stabilize individuals have been amazing. I think we are in an exciting place. I think simultaneously when you look at particular populations, it's a hard place to be because we still have rates of HIV/AIDS that is devastating and criminal, especially when you look at African American and Latino communities, when you look at young men who have sex with men or who identify as gay, when you look at young Black and Latino women, you're still looking at a crisis epidemic that speaks to not just access to care, not knowing their status, but we're talking about an epidemic at the end of the day that's also driven by poverty, homophobia, systems that don't work, systems that are broken, systems that need to be mended in order to ensure that people have everything that they need to either not get infected with HIV or if they are, be able to get the treatment and get their lives back in order. So I guess it's in this country, while there have been lots of advancement, it's still a devastating epidemic.
Mm-hmm. Okay, Dr. David Ferris.
Yeah, hi.
Yeah, hi. Mm-hmm. Welcome.
Thank you.
Can you give us an overview as far as comprehensive care at St. Luke's Roosevelt Hospital is concerned?
Oh, sure. Well, I would echo what you said. I think we've really come a long way from the early days of the epidemic. We can still very much celebrate the medications that we have. In about 1996, when we started using the medications in combination, we brought mortality down by about 70%, and we really turned this into a devastating epidemic where everyone died, to an epidemic where if people get into care, they can live pretty much a normal lifespan. And so, there really hasn't been as dramatic a change in medicine, really in any field, since the introduction of, say, penicillin for pneumonia, after World War II. So that's really a triumph. But as you said, despite that, we still have a long way to go. There's still a lot of people suffering. And so what we do at St. Luke's Roosevelt, at our 3 sites, we have 3 sites that provide comprehensive care. On the west side of Manhattan, we have a clinic on West 17th Street, and we have one at Roosevelt Hospital on 59th Street, and then we have another up at St. Luke's Hospital on 113th, 114th Street, all on the west side. And we try to provide comprehensive care for our patients, try to help them to live as normal a life as possible. And we really do have the tools and the teams to make that possible.
Okay, Nina? Anderson?
Well, I must say I see great things happening. I work for GMHC at the Geffen Testing Center.
Use GMHC.
GMHC, Gay Men's Health Crisis. And what
Health
that,
Center, right?
Health Crisis, yes. And what that is, it's a non-for-profit organization that offers supportive services for HIV positive people as well as HIV negative for women, men, adolescents. We, at the Geffen Center where I work, when people test HIV positive, I then meet with them. I link them to medical care immediately, as well as supportive services that are offered at our main building on 33rd Street. Care linking from, like I said, medical. We do linkage to housing. We offer, we have a legal department, case management, benefits and entitlements. So I definitely see great things happening after people are linked to medical care, like piggybacking on what you guys were saying. They've definitely, we've come a long way. People are taking meds and...
Okay, Dr. Eric Gans.
Yeah, sure. I'm going to sort of echo what Dr. Ferris said. I'm also at the Center for Comprehensive Care at St. Luke's Roosevelt, and since I'm an obstetrician gynecologist, I'm going to sort of focus on that area. I wear two hats at that place. I work in the Department of Obstetrics and Gynecology, but I'm also the head gynecologist at the Center for Comprehensive Care. And I do have to say that the field of HIV has sort of really swung to has really affected the obstetrical area in the sense that patients now can really have health care for the babies. Really what we see today, that you can have a normal delivery, you can have a child without HIV. And today in New York State, there is rarely, I would say, I can first of all say at St. Luke's Roosevelt, we haven't had a positive child in probably about 8-10 years. And I can say in the state of New York, there's been maybe 1 or 2 in the state of New York in the past 5 years. So what we see today, we're seeing that the medications that are coming out with the highly active retroviral therapy that David had mentioned before is really working for our obstetrical patients, that it's absolutely okay to be pregnant and to have a baby. And it's interesting, I was talking before the thing to Soraya, we were actually talking about having, in the past, we were talking about having contraception and trying to, in HIV positive patients, working with contraception. And today, a lot of my patients want not only contraception, but fertility. They're trying to get pregnant. And it's very interesting because today patients who are HIV positive are very healthy and they can get pregnant and can have very healthy babies who are HIV negative. And it's exciting. It's very, very exciting.
Okay, beautiful. Pastor Henry Harrison, welcome.
Yes, we thank you so much for your invitation and inviting us to be here today. And work with New Hope for the World Ministries. The church, New Hope Community Church in Harlem, has been in existence over 50 years. But for the last 5 years, we have a subsidiary called New Hope for the World Ministries, where we've gathered together approximately 30 churches working together, working to bring awareness to our communities and to the churches and to ministers and pastors about HIV, AIDS. And as it was said, it's a pandemic, and it is worldwide. Now, I'm glad to hear my colleagues here saying that how far we've come in the 30 years that this epidemic has plagued us, but it's still a pandemic, and it's still very rampant. I understand that from the Board of Health here in New York City, that Harlem, our area, our zip codes where our churches are, is the red zone in Manhattan. And these young, between, I think it was 92% of the new cases were black and Hispanic women who were being affected with the disease. And this is the Board of Health's, their statistics. And so we've come a long way, and yet we still have a long way to go, and particularly to educate people as to what's going on with HIV and AIDS in our communities. And I'm so glad for the progress and the medications. But one of the things that we feel as well, that the church has kind of like looked the other way. You know, many times we don't want to talk about HIV and AIDS because you have to talk about sex. And the church, you know, we don't talk about sex. Well, we don't talk about sex and don't have sex, we won't have any more people to talk to. So there is, you know, marriages, there are people that have engaged in sexual activity, and so they need to be educated as well to be responsible for their sexual behavior, whatever it is, so that they are responsible for themselves and for their partners. And so we're doing this. We have kind of passion about it. What we did a couple of years ago, we partnered with Harlem United, and we had 20 ministers stand online in a public square in Harlem at a big event there, a health fair, and we were tested ourselves to let our parishioners and people know you have to be tested. You have to know your status. And so we ministers, all of us, you know, weren't always ministers. And so you kind of like replay in your mind what could be the result of your own testing. And then we took it a step further. The next year we had this health fair. We partnered again with Harlem United that year so that at least 12 ministers and pastors took the training, so that now we are certified to do the OraSure quick swab test.
Nice.
And again, as ministers, we might get the confidence of the people who shy away or don't want anybody else to know what their business, or don't want them to think, you know, even if they're positive or negative, they don't want anybody to know that they're even taking the test because of what it might be, because of phobias and all kinds of things that are in our communities and how people think and in their families. And so we as ministers were able to do that and are doing that. And we got a clear waiver so that our headquarters at New Hope for the World Church is now a certified testing center, where people can come and be tested for HIV/AIDS in our community, in the Harlem community. So this is some of the things that we're doing, and we're just wanting to sound an alarm. Again, I think what happens periodically in our society, when the media is quiet about things, then people don't pay attention to it. They just get lulled and something else is important. Right now, we're all important about the election is the important thing right now. So that gets all the play. But there's still other things that are going on that need our attention. And I'm just grateful that you've invited us here today to talk about this subject and to make it public and again put it on the air, that there is still a problem with HIV and AIDS, and it's preventable. If people use the proper precautions, and then they can be medicated. And also we partner with other organizations so that we can refer them to where they can go for treatment.
All right. Dr. Harris?
Ferris, yes. I would like to respond to what you said, and I very much appreciate that you brought up this sense of alarm. The fact that, you know, just because we have these medicines doesn't necessarily mean, you know, it's over. Everyone's, you know, using them. What I was trying to say, if I could clarify it, is, you know, with our 3 clinics, okay, 3 outpatient sites, 2 hospitals, 25 doctors, the best drugs we've ever had, you know, social workers, nurses, OBGYN, all the different services. It's like we're waiting with with open doors for people to call and come in and get what we think is the best care in the world. But the tragedy is many of them are not. They don't know their status, and they don't know where to get tested. Maybe they're afraid to get tested, all these problems. At the same time, some people who do know their status are afraid to come into care. They don't have access to care. And this often tends to be the most marginalized people in our societies. And what happens if you're positive and you don't know it, or you're positive and you don't know it, and you know it, but you don't come into care, so you're not on drugs? What happens, just the biology of this virus, there's something called a viral load. People should know, if you're not on the medicine, then your viral load is very high. And then if you have sex with someone else, maybe you don't know your status, they don't know, it's much easier to transmit it. And that's why we have very high rates of transmission. There's still 2,500 patients getting infected in New York City every year, 1,500 people dying of AIDS. And because 2,500 are infected and only 1,500 die, you say only, that's 1,500 often young people. The numbers are going up. The prevalence is higher. We have 100,000 people in this city living with HIV/AIDS. So it's still, I don't want to paint this picture, you'll live a normal life. You have to get tested, you have to get into care, and then we try to help you live a normal life.
Exactly. Let me ask Soraya, United Health, Harlem United. Dr. Ferris mentioned the area that St. Luke's and Roosevelt Hospital cover. What area does Harlem United covers?
Harlem United provides services in Central Harlem, East Harlem, and the Bronx. And when Pastor Harrison was talking about partnerships, one of the things that we've been doing for the 22 years that we have been providing comprehensive integrated care is actually working with the larger community, so your pastors, your shopkeepers, to make sure that people are getting access to testing, right? We all talked about there's a great benefit, but if you don't know your status, and let's be clear, there is still stigma. We need to figure out why people don't want to know their status. We want to make sure that when they do know their status, it's not just the medicine, but it's all of the other social services that they need to ensure they can get the medicine and that they can continue to take it. So we've been providing services in East Harlem, Central Harlem, and the Bronx with about 9 different sites, because as the organization grew from just a social support safety net, it's 1988, people were dying in Harlem, people were confused, people thought, what are we going to do, why are all the services downtown? And Harlem United began because a group of ministers and social workers met in a room and said, okay, what do we do? What can we do? And we started out as a safe drop-in space. And as the epidemic continued and as the need grew, it was clear that we were charged. We needed to be able to create what we like to call a one-stop shop. I think of us as the Costco of HIV/AIDS. If you need it, we have built it, because you're talking about some of the most marginalized populations with no access to anything. So HIV/AIDS was just one of the many social ills that these communities have been struggling with. So everything from housing to healthcare to substance abuse treatment to on-site primary care to dental care, we wanted to make sure we built it because our community needed it. And as we did that, you got known in the community, but you naturally expanded. Your partners joined you. We wanted to make sure that since we were serving a community that was ever-changing, right? So it's not just men and women. It's adolescent. It's young men who have sex with men. It's older women. We talked about the aging of the epidemic. You know, we have the average client at Harlem United in our adult day healthcare centers and primary care clinics is 45, 50. So folks are living longer, but they're now struggling with, which in some ways it's great. I'd rather have, arthritis at 65 than not be here. But it's, from the medical perspective, it's really have kicked up the needs of these individuals. So one of the things that we wanted to do as an agency was be able to respond to the need. We could see that it was coming, and you couple that with our clients said they needed it. If you're really going to do comprehensive care, if it really was about making sure these individuals can fulfill their lives, we needed to build all of it and keep it running.
Okay, Nina?
Yeah, I also want to add, and piggybacking onto that, is that one of the things that we do, we have a mobile testing unit, and where we reach out to all of the communities and all boroughs. We offer pre and post counseling as well. We just don't just test for HIV. You know, we want to get down to prevention, how it can be prevented. A lot of people don't want to talk about it in the communities. We also go to churches, you know.
Yes.
So this is absolutely important. We want to bring light, shed light on the stigma, the shame, the guilt. It's not only infecting, it's not a gay men's disease, it's not only affecting the gay, it's affecting older individuals, you know, and young teens as well. You were gonna say?
Sorry.
Like, I think it's really important for people to know their status. Not knowing is what's dangerous, because knowing you can get the treatment that you need, you know, and definitely, you know, you keep doing your everyday thing. I've seen I have great stories. Actually, we also currently did outreach at the Circle of Sisters, and it was phenomenal. I cannot express the outcome of the African American women who came and, you know, were willing to be tested, and it was just overwhelming. It was amazing. It was absolutely amazing.
Is that services free to be tested? Is it free, or do you have to have insurance?
Absolutely no. So our services are free. It's a non-for-profit. We do free HIV testing as well as STI. We're currently doing the HIV test and the syphilis.
Okay, so you don't have to have insurance?
No, you don't.
Okay. Dr. Gantz?
Yeah, you know, I want to sort of reiterate sort of the theme that's going on around this table, and sort of mention that testing is power. You know, I really need to mention sort of the New York State law that sort of passed recently. Yay, we all can say that. The New York State law that passed in 2010 that mandates that every patient that walks into any facility, and I mean any facility of a hospital, a doctor, a nursing home, an emergency room, I guess any GMHC, testing center, any kind of a facility that has some form of a medical care must be offered an HIV test between the ages of 13 to 64. And what that allows, it allows that the patient, it takes away the stigma. It doesn't matter if you're 13 or you're 64. It doesn't matter what color, what sex, how old, who you are, that you're offered the HIV test. Now, we can't mandate it. Okay, the only time we can mandate HIV testing is on, of course, labor and delivery. We offer HIV testing on labor and delivery, but if you refuse HIV testing, then we get it from the cord blood, which then obviously is testing the mother and the baby. Now, I'm neither saying, I'm not making any kind of subjective or kind of any kind of statements about that, but that is what it is. And to be honest with you, and the testing that we've done, I would say out of the 7,000 deliveries at St. Luke's Roosevelt, I would say we had to only do about 0.1% of those 7,000 deliveries did we have to collect a cord blood. Most people, if you ask them, if you offer them, will get an HIV test. You just have to ask them.
Right.
I think
that's what it is. You have to ask them.
That was one of the most, I think, significant and powerful legislative policy changes we made in this state in a long time.
I have to.
I'm not saying it because Harlem United led the charge.
Was it really Harlem United? I think that was a fantastic. I think that was a fantastic.
It was so clear when you looked at that data, when you looked who was getting infected. I remember talking to my mother about this, and I'm like, "Mommy, in New York State, we're getting beat up by everybody, but we serve 12,000 clients annually. It was clear from the data what we needed to do. So we're pushing to change HIV testing legislation in New York State. That means doctor's gonna offer you a test. And my mother said to me, bright woman, she said to me, but wait a minute. The doctor already did an HIV test on me. I said, well, did you ask for one? She said, no, but they take all that blood every year. I'm sure there's no way my doctor, Soraya, she's fabulous, would have me leave her office if I was HIV positive. And I'm like, well, yeah, Mom, it can happen. So the issue here isn't to force somebody to have an HIV test, but to make sure that it becomes a routine part of your health care. Routine part, so the doctor has to offer you the test. You decline or you say yes. But the fact that we have the ability, as we were talking about, it's not a perfect world, but we have the ability to, once you know your status, get treatment, what that treatment can do for your own health and your community health, because there's less virus in the community. I mean, I just think it was a no-brainer. And I think it's policy changes like that that give us the ability to say, as much as we still have to do, as much as you still have, in New York City, every day 3 people are finding out they have AIDS at the point of testing for HIV, which means at a minimum you've been running around with HIV for 10 years. And what's been happening is your health has been declined and you've probably infected someone. Not because you're a bad person, because all the data shows us that when people know they're positive, they will do everything to take care of themselves and their partners. But when you don't know, you spread HIV. So we have a lot to do, but here we have a strategy that can work, and we had a policy, we had a law in this state that was making it impossible for us to advance.
And I think what that did, Soraya, was also it de-exceptionalized HIV. It really, for a lot of times, HIV became the exception in all that lab work, and it's nice to say, and after a while, HIV needs to be not an exception, it needs to be part of the routine.
No, it has to be.
It has to be sort of when you go to the doctor, and by the way, I recommend an HIV test. Sort of, I recommend to get a PSA. I recommend this test.
And if you need more information, if you need to talk about it, if you need more stuff. I think it also is clear that helps with the stigma. Let's be clear, stigma doesn't go away overnight. But the fact is, with the law we had before, doctors was making an assessment about you, right? Well, you look risky.
Absolutely.
You look like a gay man who's been having sex. So you had my mother, you had me looking a certain way. Nobody offered me a test. Everybody assumed I wasn't that kind of person. So if you change it to whether it's your mother, father, grandmother, sister, brother, uncle, nephew, everybody gets offered a test, I think it begins to help the stigmatizing that only certain people can get HIV and those certain people look a certain way. I think those are critical changes.
And addressing stigma, which is why GMHC came up with these awesome palm cards that I want to show, because we have all faces with HIV. It has no face, it's ageless.
Yeah.
And young, it's affecting. So we definitely came up with this, and it's very helpful. I noticed while we were at the Circle of Sisters over the weekend testing, a lot of African American women snatched these up because it was like, okay, this is your average wife. This is your average female who works, who, people are scared to talk about it. People are scared to, even though women were getting tested, it was like, okay, so what about your significant other status? And it was like, oh, well, I think he's good. Well, I'm going to show him this paper. So hopefully, that encourages them and their partners as well to get tested. So
I just don't think HIV/AIDS is sexy anymore. It's not. I think in the early years, there was fear. In the early years, you had different images. I think it's interesting around 1996 when we had, HAART, right? The new treatments hit the street. After that, there was somewhere where people thought, oh, this epidemic is over, right? People are taking a pill and they're living longer. So the urgency, the crisis, it just wasn't, the American public had no appetite for it, let's say. And the reality about the media is you write, you publish, you sell stories that people are going to buy, that are going to have them tuned into your station or pay attention. You know, it's the reason where I think, while I think World AIDS Day is important, it makes me insane. Because once a year on December 1st, there's media, there's stories, there's press releases, and everybody's talking, and that's great. And then there's December 2nd and December 3rd, and it's once again the invisible pandemic. It's one again the invisible issue. And when you look at the crisis in terms of communities, and you're talking about communities of color, and you look at whom when we're talking about, you know, men who have sex with men. Not necessarily something, we talk about the churches, it's not necessarily something the country wants to talk about. Sex, drugs, rock and roll, how you got HIV. I mean, in the early years, it wasn't so much about, oh my God, here's a disease, here's a virus causing a disease. It's a public health crisis, what do we do? Instead, we said, oh my God, what is this? Who have it? How did they get it? What were they doing? So the sex, the who you are, your behavior became more important than this public health crisis. And while we've come a long way, I don't think there is any, for the average person, there's any real urgency around HIV/AIDS, except for, you know, December 1st when you see a story here or there, you'll see it on the news. Oh, it's World AIDS Day, but there's no, people act like it is over. And while we're in a better place,
I think it's
not over.
We have in Harlem, several years ago, there was an organization called Balm and Gilead, which is still in existence today. They're no longer headquartered in New York, but they are very active. And the Balm and Gilead spends a lot of time educating, particularly the churches, on HIV and AIDS and its effect in the community. And they developed, at that time, a week of prayer for the healing of AIDS. Panessa Seal, who's executive director for that organization, had this week of prayer, and it started out as a Harlem week of prayer, and then it's now international now. But during that week, I think it's like the first week of March, again, it was calling attention to the problem, and particularly through the religious communities, and bringing into the bringing awareness to all denominations and having this week of prayer. This past year, during that week of prayer, we at New Hope for the World Ministries convinced maybe about 20 churches in our community to put red ribbons on the outside of our church that were just out there, and for the reason for people to ask us, why is this red ribbon outside of your church? And again, it's to bring awareness. And we left them there for that week and that basically that month. We're going to do it again. We're trying to get other churches, and we're aiming maybe at 40 churches this year, at least to jog people's mind, to put a red flag, the red ribbon, but a red flag in their face and saying, there's something that needs to be done. This still is a pandemic. It's still affecting us here. And it's going to be organizations like Gay Men's Health Crisis, like Harlem United, like our doctors here, that will kind of sound the alarm. And as I said earlier, for the Bahamian American Cultural Society to put this out, to do this on media, you know, to say that it's a problem and we're calling attention to it. But we all have to network together, work together to bring it to the attention of people, because, like I said, the media, if it's not, you know, really earth-shattering, some disaster, they just get lulled. Oh, that's an old issue. We don't want you to talk about that. We know about AIDS. We know about HIV. And now, one of the things that we've been working with the different areas that are affected by HIV and have a common disease with them. We worked with doctors on mental health, how it affects our mental health. How it's in a lot of areas, in a lot of homes, it became abuse. There was a lot of abuse in the homes because of this HIV and AIDS thing. And so we're developing each year, trying to reach people and letting them know that there's so much going on. A lot of the STIs, are related as well, and they are spreading as well in some areas. So we really began to bridge a gap because we were calling attention to something that they didn't want to deal with. And one of the ladies who was tested had some kind of rash on her body that they weren't familiar with, and they called Dr. Bocard. She said, you know, I've only seen this kind of rash when I've dealt with some venereal diseases. And they began to test that, and they began to see there was an association with this disease and this woman and HIV, and she was also positive. So, you know, but that we've got to sound the alarm, and that's what we're just doing. We're just ringing our little bell and saying, yes, there is a problem. There's many strides, and there's so much available to us. And with Soraya and Harlem United, we were there in Albany for testing, so that Governor Patterson then did sign that bill.
Wow.
So that people could be tested, and taking away again that stigma or making it a special thing. Just like you get tested for high blood pressure or get tested for diabetes, then you can also get tested for HIV and know where your status. And we keep pushing that issue. As Nina said, you have to know your status. As Dr. David said, you got to know your status, and we got to keep pushing people to go get tested. And the testing is free, and it's available.
The listeners should know about another new development, which is the FDA approval of home HIV testing. You can now go into a pharmacy and purchase an HIV test and test yourself at home. That's a huge development, and it's only possible, you know, because of the way the disease has changed over time. And all the laws.
Is that, can you get it with your insurance, or is that
I believe you pay
over-the-counter?
for it, yeah, over the counter. It's not a prescription. You just walk in, you find it on the shelf, and you can get tested and test yourself.
Okay.
There's a 1-800 hotline connected with that if you need some
If you're
conversation
positive,
and counseling and
of course.
referral.
Yeah,
Now,
and
there
they
are a
can
lot
plug
of-
you into care.
Care,
Because
right
once
there.
again, knowing that you're positive is not very helpful unless you go and see somebody about it.
Right, right. Did you want to say something?
No, I was just totally agreeing with that, you know, about being connected into care. I mean, if you're positive and you don't do anything about it, you're sort of stuck in nowhere's land. So you have to do something about it, absolutely.
Yeah. Now, there's a lot of research. So we're up as far as research is concerned. I mean, we're really doing fabulous in that area of research. But media is lacking, or getting the word out, the campaign to get the word out. Do you think that government or the governor or the mayor should be involved in seeing that, you know, the word is out there? Especially now that, you know, if you're positive, there's medication there that can give you long life. Without the medication,
There have been stories. I mean, I think what we're all saying is not enough and they're not sustained. So they happen at certain times. So there's World AIDS Day or
The big AIDS walk.
the big
that we
AIDS
have
walk.
every year.
Right. The GMHC does. So you'll get some media around that. When we looked at, you know, there was a lot of media, if not a lot, but there was media around some new HIV prevention strategies, some prevention tools. They call it biomedical. So, you know, there's something called PrEP, pre-exposure prophylaxis, that you can take if you're negative. I mean, when there's something new, I guess, big, there is a story. When the testing passed in the state, there was a story. But it doesn't sustain itself for the level of health crisis. While better, I'm clear, that HIV/AIDS still is, the fact that there is not ongoing stories, ongoing conversation, when you still have the level of stigma, when you still have, and I know a lot of this is systemic, right? You're not going to change homophobia. So somebody once said to me, well, Soraya, if there's so much good stuff, right? You know, she said, I see ads on the subway, ads on the bus, ads on billboards, get an HIV test, et cetera, et cetera. Why doesn't everybody know their status? Why can't we do X, Y, or Z? Why is this still such a crisis? And I think it's some of the stuff that we talked about, right? HIV/AIDS is a disease of poverty, sexism, racism, homophobia, mental health issues, substance abuse issues. So it's not because people are like, I don't care, I'd rather continue to shoot up. I think you have to look at the epidemic of substance use and what drives that. People's sense of their lack of power, poverty, education, it's all of that stuff. So while you've got HIV and there is great and better treatment, there is free HIV testing, there is housing program, there are housing programs that are free, you can get services. We have to look at all of the kind of system issues, racism, sexism, poverty, psychosocial, all of the stuff that's always been there with us when we talk about HIV, prevention, treatment, or care.
Yeah, let me just sort of go on a little bit what you just said is that, I think all those are fabulous things that you just said, but I think, again, with the Harlem United getting that law passed, I think that was fantastic. The fact is that with that law, to sort of dovetail on what you were just saying, is that law is mandatory. That the physician or the healthcare provider must every year, and I'm not sure if it's every year or if it's every year must offer the test. And what I'm trying to get at is it's not just offering the test; it's offering the 7 guidelines, the 7, if I'm correct.
There are 7 bullets or
7
pieces
bullets.
Of information.
So, and that's where they're going to get, if they're not going to get the media attention, if the media can't get to it, if the government can't get out with all these signs and information, they're getting it from their doctor, hopefully by this law, once a year, these 7 bullets. 1, 2, 3 through 7. If you are positive, this is what happens. If you are negative, this is what happens. This is how you can protect yourself. If you're positive, this is what it means, and this is where you need to go. And there are 7. And now, granted, it may not be a verbal situation. It can be on it can be on a pamphlet. It can be on the wall. But if the media misses it, if the government misses it, if the December 1st is only one day, if GMHC doesn't have enough of these to go around, if there's not enough,
We'll make more.
We'll make more.
We'll do more outreach.
But hopefully this law will kick in. Now, there's been some issues around it with certain private docs and institutions not being able to comply and so on and so forth because of its complexity. But I think all around it's a great thing.
So where do we go from here? What would you suggest? I think something has to,
I think
we have the medication, the services are there. Where do we go from here?
I think you start to look at, it's huge, right? You start to look at some of those systemic issues. To me, changes in healthcare reform, the Affordable Care Act, it's a huge step. Because what it promises, it's like everything else, the devil's in the details, but we know we have had a fractured, broken, unfair healthcare system where it was about better care where you live, better care, your socioeconomics, and we're looking at healthcare reform to say, no, we can provide healthcare for X number of people. I think that's where we are. We're talking about, having now a national AIDS strategy, where in this country there is a coordinated, driven strategy, recommendations that talk about how we're going to stop the epidemic, what's the goal, how many numbers, how much we want to reduce it, how many people we're going to bring in care. There are priorities that our country's saying is what we're going to spend our money on move on. I think we still need to do research, because I think until there's a cure, there isn't a cure. While we have promising prevention strategies, it's not going to stop the HIV epidemic. So there still needs to be dollars for a cure and a vaccine, absolutely. But I think at this point, we also now need to look at some of our structural issues in this country.
I think that, on a daily basis that, what Soraya was saying, but on a daily basis, what David and I go through every day in our Center for Comprehensive Care, that I think that HIV, for most of these patients, HIV is the least of their problems. The least of their problems. That most, if I'm correct, David, but in most of the patients that we see, a lot of them have issues way beyond HIV, and it's not just their medical condition. If they could just get to the clinic and not come in high, or come in, and take their medication, or that's there, or make sure they can, not end up in, have a home to stay in. I mean, those are
I think we've done a very good job of identifying the factors that keep people from getting the care that they need, and identifying the factors that get in the way of people taking their medications. What we need to make sure that we always have resources to overcome those barriers. And so the ones that we talk about, homelessness, mental illness, drug abuse, stigma, lack of health literacy. We have to have the resources to overcome those barriers. And so we have a great program, actually, which is called the Care Coordination Program. We have a patient who's dealing with a lot of those psychosocial issues, making it difficult to get the care that they need. We actually can refer them to that program, where they get their own care coordinator who tries to manage their case and plug them into the services that they need. They even get a patient navigator, and that is someone like a peer who will actually sometimes go to their home and pick them up and bring them into clinic when they need to. It can help if we didn't really talk about some of the other medical illnesses that could go along with HIV, such as higher rates of different cancers. But, God forbid they do get cancer, but then they're not going to go get the care that they need to take care of that properly. The patient navigator can go and make sure that they get to the cancer center. Another thing, I just came off 2 weeks on the wards at St. Luke's, and I must say, we opened with this rosy picture, but every day there are people dying of AIDS in hospitals all over the city, whether it's in Brooklyn or the Bronx or in Manhattan. And one of the best things that I can do every time I go on the wards is to find that person who has been out of care, might not have known their status, maybe they knew but they never saw the doctor. They wash up onto the wards and they're sick with an opportunistic infection, maybe PCP pneumonia, as if it were 1986. We have to get them through that acute illness. That's one thing. But the most important thing is to get to them when they're on the ward and bridge that gap so that we can get them into the clinic. And we send our peers to meet them. We send people who are HIV positive people who volunteer, that they'll go and they'll visit in the hospital, try to let them know, there's a place where they could go and they don't have to keep going back into hospitals. And then we can send people from the Care Coordination Program to try to sign them up. And then after I discharge them, someone can go and find them and bring them into the clinic. Because once you get into the clinic, we can help you deal with the drug abuse. We can help you deal with mental health issues. And of course, we have those great medicines. If you just take them, you can live a pretty normal life.
Now, does the Obama health care improve this health care that we're now talking about? What happens if it's repealed? Let's talk about what's happening now.
If it gets repealed. No, I said I'm moving to Canada. No.
So you think that the Obamacare will have a tremendous impact on this?
Negatively.
I think it's a very good start.
If
to repeal it would be a step in the wrong direction.
If you repeal it, we would see a huge negative impact if it's repealed.
Is it helping the situation at this time? The Obama?
Yeah, I think just the pieces around, you can get insurance,
right,
and there's no pre-existing condition.
So that is in effect right now?
Yeah, that
absolutely
piece is in effect. Most of it won't roll out till 2014,
right,
where states get the ability to expand their Medicaid, and we go into, health exchanges and people can buy insurance. I mean, there are all of these great possibilities that we're waiting for, but right now, the way it is, there is a benefit. There is an impact when we're talking about diseases, and definitely when you're talking about HIV/AIDS. The rest, we don't know.
Okay, we're going to be closing, so I'd like for you all to give closing remarks or talk to our audience and let them know what is possible and what would you like for them to do and what should they, do tomorrow. Come and get tested. Sarai, you want to start?
Well, I'll start by saying thank you. Thank you so much for allowing me to be a part of this and talk with my colleagues. We could talk forever, as you know, as you can see. I think, it's the way I open. I think HIV/AIDS, 30 years later, we are in a great place. We really are. I think what people need to remember is it's not over. As the doctor said, people are still dying. People at an alarming rate are still getting infected. People are still not able to deal with knowing their status and getting the access to care. I think individuals, on an individual basis, what I would want people to do is tomorrow go out, talk to your doctor, get an HIV test. That's the thing you can do for yourself and for your community. I think on a larger goal, because I think issues like systems that are broken from healthcare on is to make sure you vote. I don't care who you vote for. Well, actually, I do. But make sure you vote. Make sure you participate. Make sure you pay attention. And I think to remember that the person living with HIV/AIDS, this always makes me insane, is first a person. And it's not how they got infected, what the behavior was, but that person is infected, that person has a disease, need our care, need our services, need our compassion.
Okay, Dr. Harris?
I really can't match how well you said that. So I would really just reiterate what you said, and if you have HIV, you should come and get into care. And if you're looking for a good doctor, and you want to come to the Center for Comprehensive Care at St. Luke's Roosevelt Hospital on the west side of Manhattan, you can call 212-523-6500. It's 212-523-6500. We can get you an appointment for an initial visit within a few days. We really try to have open access. If you know someone who needs a doctor, please, we're waiting for you to come in. If you think you might be positive, we have free testing at all 3 sites. So we don't want you to be one of those people not doing yourself a favor, also not doing the community a favor by not being in care. So come into care, and we can help.
Nina?
Well, as I must say, GMHC will continue to be in the fight to end the AIDS epidemic and to uplift the lives of those who are infected. Come in, get tested to know your status so that you can be linked to medical care. If you already know your status and you're positive, you're also welcome to come down to the Geffen Testing Center. You will be linked immediately to medical care. One of the issues and concerns is insurance. Oh my God, I don't have insurance. We work very closely with social workers at the hospitals where we refer them. Excellent infectious disease physicians who will, they start the ADAP process, as well as so what happens from there? You're in excellent hands. We have supportive services, group mental health. If you need help with benefit entitlements, a hot meals program, like the works. So definitely come in, know your status. If you don't know your status, to not know is...
Dr. Gatz?
Well, I want to say thank you, Beryl. A wonderful, wonderful presentation here, and sitting with my colleagues, it's always wonderful. I just want to say, reiterate what everyone's been saying, is testing is power. I really feel that to get tested tomorrow, and knowledge is power, and to go, clearly, I feel you should come to St. Luke's Roosevelt, but clearly you can come to any of the places to come and get tested. And you can come to any of the places, and again, I think you should come to St. Luke's Roosevelt to get your care, but again, any of these wonderful places can get wonderful care. And as a gynecologist, I'm going to say, for prevention, for both, using condoms, obviously, is the forefront for prevention at this point, and that's about it. So I'm going to stick with that.
Again, we thank you for, again, having us come and share. For about the last 13 years, I've been traveling yearly at least, sometimes twice a year, to Uganda, East Africa. And they were having such a problem with HIV/AIDS that almost 50% of the population were affected and infected. And it started with the president of the country, who said, if we don't do something, there's not going to be anybody here. It took them about 12 years to really kind of bring down the numbers to almost zero of new infections. But it was about 12 years to do that. Many people died, but they had billboards everywhere. The president, the parliament, everybody in the country started singing A, B, C. Abstinence, B, be monogamous, and when they put that together, it worked. It was a long time, but it worked. So we got to everybody do their part to sound the alarm, and we can see a difference. I'm glad for all that we're doing. New Hope for the World, ministries.org. That's our website, and you can find out more about what we do.
Okay.
GMHC also, we go to schools and we do testing, but like I said, it's very, so absolutely.
I want to thank you all. It's been a pleasure.
Thank you, Beryl.
And I hope we have empowered our audience to be tested tomorrow. Take time and be tested. Are the weekends services available?
At Harlem United, we are open 7 days a week.
How about at St. Luke's?
Our clinics are open Monday through Friday, about 8:40 until 5. And on the weekend, of course, our emergency rooms and our inpatient services are always running.
Okay, how about
24/7.
By appointment.
I see, okay. Thanks again. It's been a pleasure.
Thank you, Beryl.
Absolutely.
Thank you for having us. Thank you.
In the Bahamas, yeah, really, we'll go to the Bahamas and do it there.
Yes.
I'm ready.